Hi everyone, welcome to Sean Burgess Fitness and thank you for tuning in to our latest Flexibility Matters video on how to trigger point the piriformis. So before we get into the technique, what we're going to be doing today, let me just say that the piriformis is a deep tissue muscle located behind the glute max. So if you're not sure where your glute max is, it's the primary muscle group in the actual hip joint, okay? Very important for many reasons. You know, from a training point of view, your glutes are obviously going to help you in extension with your leg going back. It helps with rotation, helps to stabilize your knee joint, helps to stabilize your lower back. It's got many functions that are really important. So often, for many reasons, the piriformis, with that deep muscle underneath it, gets quite tight. And it can be from a pelvic tilting, it can be from sometimes from overuse, it could be from an actual direct strain linked to obviously a athletic movement, even squatting or playing a sport. And when it does obviously get very tight, it can cause what you call Piriformis Syndrome. You can even strain your piriformis, and that obviously leads to the syndrome as well. When this happens, it's not very nice. I've had it myself. It really does limit obviously the movement you have in that leg in terms of your knee extension and in terms of your hip extension as well. And it's quite a dull, constant ache, and that can even refer itself into back pain. So you really want to make sure that if you are using your glutes quite a lot, and you are doing a lot of training, and you are maybe wary of your posture, that you just every now and again throw in a trigger point on that identified side of your piriformis, which you know might get tight. So to obviously go through the technique, what I recommend doing is getting a quite dense ball. Okay, so this is a lacrosse ball. I really recommend these. I use these a lot in trigger point work and just therapy in general. You could use a cricket ball, but I wouldn't go much softer than that. So possibly a brand new tennis ball might do the job, but I wouldn't really probably recommend it. I'd always go lacrosse ball or cricket ball, really. I know it sounds a bit brutal, but if it's too soft, it's not really going to do any good. And because the piriformis is so deep down, obviously like I said, behind the glute max tissue, you need something which is really going to obviously be able to get into those deep fibers, because otherwise you're just not even going to touch it. All right, so what we're going to do is literally sit on the ball. I know that sounds a bit strange, but you need to locate your piriformis, and just the easiest way to say this is literally directly in the middle of your glute. Okay, so we're going to sit on the ball, okay, so just make sure it's kind of in the middle of the glute. So you can always locate the greater trochanter and just at the back for your iliac crest, and kind of run a line and sort of try and meet in the middle. Or to be honest, if you want to be a bit simpler about it, just roll around until you find the tender point, that trigger point, okay? So because we're working on the right side, we're actually going to cross the right leg over the left, all right? And that's just going to allow us to get a little bit of an angle. So if we do need to tilt, obviously in towards the muscle group and apply more pressure, it's easier with the leg crossed, okay? Ideally, we want to try and keep a good posture, but just getting into a good position is more important first. So once you've found it, so for me, it's about there, that feels quite direct. We're just going to literally hold that position and not move. So as I've said in all the trigger point videos, the pressure, you know, might take anything from 1 to 5 minutes to fully relax and ease up. So it really varies. I would say with this one, expect it to be a longer time frame because it's deep tissue. Obviously, it takes longer to penetrate into those fibers, and it's going to take a little bit longer to obviously ease up. And also with the piriformis as well, don't expect it to be a complete fix the first time you do it. If you've got Piriformis Syndrome, it's going to be something you're going to have to do very regularly, like daily, and it's going to sometimes take a week, a couple of weeks to obviously try and fully release yourself in terms of the tension, and you will need to do some other rehab exercises around it as well. So that is your technique. You can do this on the floor. But again, if you're going to do this on the floor, make sure it's a hard floor, so don't go on like a soft exercise mat, that's not really going to do anything again. And just make sure you also keep a little track of like time. So if you're there for like 10 minutes and you're just not changing, then probably what's happened is the muscle tissue's gone a bit numb, and you know, you need to obviously come off it and then go again. And it works really well if you try and stretch after you do the trigger point. That will really help to lengthen those tissues, and then hopefully you'll get a better result. Any specific queries, guys, obviously remember to get in touch. Thank you for watching as always, and I will look forward to seeing you again soon.